Good morning, good afternoon, and good evening. This is the Chronicles of Apple from the Apple of My Eye, and I'm going over how to take care of patients with COVID. And I'm done with work, but I wanted to kind of share this video. And I know a lot of people have probably recovered from it, so this is nothing new for you. But for those that are new and taking care of people with patients with COVID or their loved ones with COVID, I wanted to kind of share some of my experiences and things that I find working. And just so you'd understand, I've seen people that have been out of the ICU, they are out of the hospital, and they're back home. And what are you going to do with your loved ones when they're home? Number one, typically, the patient will have a home health, occupational therapist, physical therapist, speech therapist as needed, depending on the debility. So if they are not able to dress well or to move well, physical therapy, occupational therapy, and physical therapy will be involved. And if they can't eat or they can't swallow, then obviously they're going to need a speech therapist. The referrals are usually going to come from the doctor. So what I train the patient's family with is basically teaching them how to move the patient and how what progression the patient need to have in order to improve once they're at home. And typically patients family are very worried. They don't know if their loved ones are going to die at home, or are they going to be able to are they going to overdo it for the patient, or is the patient doing enough? Okay, so number one thing is when you have a pulse ox, you want when you have a pulse ox, you want to keep it above 92. Okay, 92 is already borderline. You want it at 95 and above. It's not going to be more than 100. 100% is 100%. Typically speaking, you and I will be around 100, 98 to 100 or 97 at the least, if you're able-bodied. Now, if you're huffing and puffing, you're going to go down to 96, 95, 94, 93. And then when it hits 92, that's actually becoming a borderline where you're starting to need like 90 and 88%. Those people need oxygen. If the patient goes home with COVID, typically sometimes they may need oxygen, or they may be on intubation or something if they are in a kind of a skilled nursing setting. The best thing is to know the baseline of the patient. If you can see that the patient's oxygen is hitting 100% on oxygen, they're doing fine. If they're hitting 98, they're hitting 95. So again, you want about 95 and above, but 92 to 95 is kind of okay if they are situated well with oxygen. Okay, so if the patient started out at home and needing oxygen, or maybe they don't need oxygen, once you check the pulse ox and you are within range, then it's good for the patient to be encouraged. Number one, you need to encourage the patient to move. One of the best thing is to not be flat. Obviously, you don't want the patient flat as a pancake. The lung is not working this way. The lung, it needs to be upright, or 30-degree recline. When it's a little bit suspended, it cools it up and it allows the lung to be able to move. If the arms are up or out, that expands the chest, that expands the lung capacity, okay, to have more air, okay, and to compress and to have more air. So as the body goes this way, more air goes in. As the body crumples over, less air, okay. So you don't want the body to be in this position, okay. Okay, you don't want them flat, okay. You want the patient a little more upright, opening up the chest, okay, and ideally arms out, going out. Okay, so first activity to do when the patient is laying flat and they're not sure how to move or something, moving the head, have him move the eyeballs. Okay, 8 seconds up, 8 seconds to the right, 8 seconds to the left. Look to the top right, top left. Look down this way. 8 seconds. Okay, neck, move the neck left. Okay, left 8 seconds, right 8 seconds, up 8 seconds, look this way 8 seconds, look that way 8 seconds. Okay, so when the patient is moving the neck and doing some kind of neck rotation, there are lymph nodes coming out of here from the lymphatics. There's lymph nodes coming out of the armpits. There's lymph nodes coming out of the groin area, coming down to the knees, coming down to the elbow. all the way to the wrist, okay? So lymphatics are like tree trunks, okay, spreading into the body, top to bottom. So you want to affect the lymphatic system. Therefore, you have to have the patient moving in an axial rotation, which is this, or hip gyration. Now, oftentimes they'll be a little bit stiff. If they came from the hospital, they have not been moved well, there's not that many people probably in there, the patient is afraid that they'll move and they're gonna get sick or they can't handle anything, okay? So you want to teach the patient how to move. Start out with the eyeballs, the neck, the shoulder region. If they have no arm movement because they are very, very weak, you can have them at least jiggle around and try to do this, okay? And I literally have a patient who was intubated, and I said, just jiggle your body. And the patient was cognizant enough, and she did it. She would jiggle her body, and she would move her. She was already moving her neck a lot, which is her point of control is the neck, okay? So the more portions of their body that they can control, the better off that patient's gonna feel. Now, as a caretaker, you wanna empower the patient. Okay, so I'm gonna go over this as quickly as possible. You check the pulse ox. The patient is doing a little bit better, 23, 24%. Have the patient roll side to side, okay? Have the patient roll on this side and you do tapping. Okay, patient's feeling better, roll them to the other side, okay? And they generally will tell you how they feel. Tap the back, okay? And you can even sing a little song, dun 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 dun, okay? So you have them rolling side to side. If you're at home and you can do it every hour, certainly do it every hour. If you could do it every 30 minutes, that's even better. Okay, so once the patient is tolerating that, sitting the patient up is another thing to do. When you sit the patient up, make sure that you kind of give that patient a little bit of a back support and get the feet supported with a stool so that they're not dangling too much. So if they're dangling, that's hard, but if something's holding the feet, then they feel better. So sitting them upright and then tapping their back is good, okay? You can rub their shoulders and that makes them feel better, rubbing the shoulders. You can again have the patient do some slight jiggling or axial rotation. The slower the better, okay? Now you continually check the pulse ox of the patient. You won't be taking blood pressure on a constant basis, it's unnecessary. You could take it pre and post or in between if you want to, but generally speaking, the pulse ox is enough to kind of tell you how that patient is doing. And they can also talk to you as well. Now, obviously, rubbing the shoulders is going to make them feel good. Tapping the back makes them feel good when they're upright. Once the patient is ready, you can stand the patient up, put them on a wheelchair, put them on a rocking chair, have them rock back and forth, okay? Start out with about 10 minutes of sitting upright, and they generally will feel better because the lung is upright. Now, I'm going to let this one rest for a minute. Now, if they get tired, you lay them back down. Again, what do? Let the patient move their neck, let the patient move their fingers, let them jiggle their feet, move their hips, okay? They can do a side turn and then rocking back and forth, rocking this way back and forth, okay? We're 8 minutes. Okay, so other things that's going to be good for the patient is actually moving. If they're seated, pull the shoulder blades back, okay? And this is called the Brugger's, okay? Brugger's is this. They double chin. They bring their arm out, and that expands the chest, and that increases the oxygen. Now, having the patient pass an object left and right is good for them. They could do it laying down, 30 degrees up, or they could do it seated, okay? Again, they're bringing it out to the sides, right? When they do that up this way, okay, you can have the patient toss ball back and forth, okay? Do that for a few seconds or seconds to a minute if you want to. The patient's tolerating it. Balls give a very happy feel, good memories and everything, and it generally makes them feel better. When they're catching and talking and counting and singing, all that stuff increases the oxygen, okay? The more the patient is able to expand their arm, like they could do it laying down, that expands the chest and increases the oxygen. That is if they're hitting, they're tolerating the activity. When they're desaturated, probably not the best to be raising the arm too much because it increases the heart rate. But moving that arm out to the sides is very important. Another thing that's really helpful is making sure that the nasal passages are clear. Coughing is important for them. If they're desaturating, they need to cough. Sometimes the nasal passages is clogged up, they need to blow their nose. If there's blood in that stuff, obviously you gotta tell the doctor, but usually it's an irritation of the nasal passages. They could use nasal gel. You want to have a humidifier. You want to have an air cleaner. You want to have a humidifier nearby them, or have some steam going into the air. Okay, not steam, hot steam, but more like kind of like the higher the humidity, the better the patient is going to be able to breathe. If the nasal passage is clogged up, that can be taken out with like something to suction the boogers out of the nose, or they can, the patient blows it up or use saline solution to clear up the nasal passages. When they open their mouth, the oxygen goes up, but when they're just breathing through their nose, they desaturate. That means that it's clogged up in their nasal passages. So you want to have humidifier, you want to have nasal gel. Nasal gel is actually going to break up the problems in the nose. Tossing the ball back and forth is an activity. Target shooting is another activity. Once I see that the patient is doing well, I want them to sit up longer than 30 minutes or so. Have them eating seated, have them combing their hair, brushing their teeth, going to the sink side, pulling up to stand. I will stand them up at the sink side. I will stand them up at the table. I will stand them up in the bathroom. All these activities, you're checking the pulse ox. Okay? Every 15 minutes, every 5 minutes if needed, every 3 minutes if needed. And you let that patient develop a sense of control. Okay? The more they can brush their teeth, comb their hair, put on a shirt, go to the bathroom, the more the patient feels in control, and the more they know how to bring up their oxygen level, the more in control they feel. And the more satisfied the caretakers will be at giving the care. What other things? Oh, I'm just getting some messages. But anyhow, I'm going to keep this as short as I could. May have to cover more. But again, ball exercises are good for them. Breathing and counting and singing. Jokes are good for them. Tapping the back. If they're strong enough, you could have them, do some kind of a towel activity, rub their back, because that brings in a lot of blood into the lung region, because you're moving the arms back and forth. So axial rotation and doing this, very good for the patient. Moving the hip back and forth, in and out and in and out, is good for the patient. If eventually you can have them leaning forward and back, reaching up, checking the oxygen from time to time. Okay, so I'm gonna end it right here. Thank you. God bless.